I've known you for years and know you're a fiscal conservative and you've done a heck of a job in Washington. On behalf of healthcare, I must say you've always supported medical education, so the future doctors, the future nurses that we have, you've supported access to health. Coming back to Missouri,
Right.
How will you apply what you've learned from Washington to access to health?
Okay, great question. For those of you who didn't hear, this was not a planted question, a softball question. Let me just, how many of you, were any of you at the healthcare panel discussion that was here last Thursday with Newt Gingrich? Just a few of you, 2 of you. The discussion was that the point was, along what Leanne's question, again, for those of you who couldn't hear, and that is healthcare. How do you take this perfect storm, to use the words of a former colleague, now deceased, Charlie Norwood of Georgia, when you consider all of the challenges of healthcare? You have, at one time, you had doctors and nurses whose livelihoods were being threatened because we had out-of-control lawsuits here, in my view. And so venue reform, tort reform have been a good thing. Medical malpractice and premiums have at least leveled off for those providers and have started to come down for some. At the same time, the federal government, CMS, has been ratcheting down the reimbursement for those providers who see senior citizens patients. Medicaid is not up to par here in the state as far as reimbursement of providers. If you're obviously, those of you in business, how do you provide health insurance for your employees when you see double-digit percentage increases every year? Not to mention the shortage in certain areas with primary care physicians, with technicians, with nurses. The uninsured, the number of uninsured, the community health clinics, again, all of these things are cascading together and have put a number of challenges that both at the federal level and at the state level. I applaud the discussion that's happening in the halls of Jefferson City right now on Insure Missouri. Again, assuming that it may not get across the finish line, it is a good starting point for discussion where we can talk about what can we do. Now, I will tell you, Leanne, you mentioned my conservative credentials. My view is that we have to do that through the private sector. And I know that there are others in this race who immediately would say, let's just turn the clock back and put everybody who is excluded from Medicaid, for instance, back on the rolls. Quite frankly, the old system was not that good of quality of care for our patients. And to me, the most important thing is, how do we provide the best quality care for Missourians? How do we protect that safety net for our state's most vulnerable? And the ideas of prevention and wellness have to be part of it. For instance, 1/4 of those on Medicaid right now in the state of Missouri that are chronically ill, when I say chronically ill, typically I mean those that have comorbidities or multiple maladies, and they are responsible for 2/3 of the Medicaid dollars. So is there a way, for instance, that we can focus on management of health care for the chronically ill in the state to not only help them be in better personal health, which we all support, but also to help them be, the system be in better financial health? I think, and this is something at the federal level as well as the state level, we have evolved to a healthcare system in the country and in our state where we rely on third parties to provide our health insurance for us. Can we help individuals have some stake or investment themselves in their own healthcare decisions? Whether it's health savings accounts or a host of other ideas where just even a modest copay might get someone to think twice about, well, I'm going to go to the emergency room, if you know that you have to reach in your pocket and have a copay. And so the discussions, just as we've had them, and I think, again, I have a unique experience as someone who has dealt with federal health care issues, not only those affecting the region's biggest employer, which is BJC, or those from the Children's Hospital Network, which I've been a huge supporter of, and medical education expenses, but taking that experience that I have in the healthcare field on the federal level and then rolling up our sleeves and working on those matters at the state level. And I think these discussions have been good. This is the type of thing that, in fact, it took, as you know and others may know, it literally took an act of Congress for us to implement changes like early screenings for colorectal cancer, for pap smears, for mammograms, for type 2 diabetes test strips. When you consider that 25 cents out of the healthcare dollar goes to the onset of complication of diabetes and not managing diabetes, shouldn't we then help those individuals who have diabetes, whether it's not just nutrition, but a number of other things as far as monitoring, again, better personal health for the patient, which I support, but financial help for the system itself. So this is a vexing, difficult issue, but the discussion has begun, and I applaud the discussion, and I look forward to moving us ahead. Let me just, as the big hook is coming, I ask for your support. I'm not sure if I'm allowed to do that or not, but let me. First Amendment. I have a First Amendment right. I ask for your support. We live in an awesome state, and this is an incredible region. And for those of you that live across the river in Illinois, this regional concept is very important. There's a similar one that I've been involved with in the northeast part, with northeast Missouri and west central Illinois and southeast Iowa in a tri-state summit where we have looked at ways to be collaborative in a regional way. But we want to do what's in the best interest of Missouri. And Missourians deserve a government that's worthy of their respect. I think we really stand at a crossroads here in our state. And as voters slowly turn their attention to this governor's race, and as they begin to take the measure of each of us, I hope you will, as you inquire of others, scratch beneath the surface, drill down. It's easy to make a speech. It's quite another thing to understand these issues, the depth of these issues, or bring passion to these issues, as I hope to. The choice I think that we have is, do we continue to build on some good progress with a bold initiative into the future, or do we turn the clock back to bloated state governments, to out-of-control lawsuits, to a government that we can't afford? For me, the choice is simple. We forge ahead with strong initiatives to help make sure this economy is a world-class economy, that our education system is world-class and second to none. And that government is lean and efficient, responsive and responsible. That's the type of government, that's the type of administration, that's the vision that I have for our state, and I ask you to join me as we achieve that vision together. Thank you for your attention today.